Hi, my name is Dr. Dev Teo Sydney. I'm a qualified physician and geriatrician. I've been in Ipoh Specialist Hospital now for the last 4 months. Currently back from the UK in Oxford, where I did my training there. And I have, apart from treating older people, a subspecialty in stroke and Parkinson's disease. Poor sleep is one of the unrecognized conditions pertaining to the elder person. A lot of people cannot sleep very well and may just associate this with common habit or something that comes with age. This is not the case. Old people sleep the same amount as a younger person, and research have shown that the quality of sleep is not reduced with age. We wake up very often, going to the toilet, waking up concerned about some problem at home or something on their mind, and this disrupts sleep. And how this presents the next day would be lacking in mental function, poor concentration. They may not be working, but they may not be either happy the next morning with carrying out their functions. And this will then lead to more sinister problems. For instance, if they're driving, if they're walking and not paying attention to the pavement and falling down, and they may not be too careful with their money if they're handling their shopping. So sleep is a very important factor, although very, very salient in somebody's life. There are many conditions and it can cause poor sleep. One of the major causes of poor sleep at night is depression. They have poor quality sleep, thinking about their problems, worried about something, having anxiety, and having poor quality sleep during the night and affecting the next day. There are certain conditions pertaining to thyroid conditions where the patient is got an overactive thyroid, may not be able to sleep, may not be able to rest very well, that have been just neglected or undiagnosed. The use of sleeping tablets is very rampant, and long-term usage of sleeping tablets can be very addictive and detrimental to one's health. As we get older, if someone's addicted to using lots of sleeping medication, the natural thing is to increase those with time. How do we diagnose this? A simple question and answer with the doctor, probing the question on sleep, mental function, moods, and also their physical activity during the day, could easily ask the simple question of how well do you sleep at night. Now, ways of ensuring a good night's sleep without any organic conditions would be good physical activity during the day. It has been proven that if one has a good sense of physical activity during the day, the sleep would be much more rested during the night. Avoidance of any stimulants very late in the day, coffee drinking and tea drinking. Tea has caffeine, which may not be known to some, that can easily provoke a poor night's sleep. Alcohol has been used in the past for sleep, but research have shown that alcohol consumption at night will diminish the REM sleep or the good quality sleep, and you will end up with a poor night's sleep and thinking you may need more alcohol the next day. Treating one's depression and treating an anxiety disorder would also ensure that your sleep at night would be optimum. For men in particular, waking up at night to go to a toilet is one of their banes in life. Some patients may wake up to 4 to 5 times a night every hour on the hour to go to the toilet. If we can treat the simple thing related to an enlarged prostate or an overactive bladder, the patient can instantly have a good night's sleep and would not fear the need of wetting their bed, the need to get up at night and risk of falling in the dark, and all of these risk factors can be somewhat diminished. So anyone with any problems with urinating, anyone with any difficulty with their prostate or overactive bladder should get it treated to ensure a good night's sleep. Treatment options that are available at the moment will be changing the cycle of difficulty sleeping at night and somnolence during the day, which is increased sleep during the day. We could regulate this with medication. We could treat the depression. We could find out if the patient has got any other organic conditions like an overactive thyroid or prostatic problem, over an overactive bladder, or even a simple thing of having too much rest during the day where one should be more active. So if for those who are thinking of a solution or a diagnosis into why they can't sleep, there are many things one can do. They are not alone.